Is it, okay, vestibular system on the left, and then kind of do it before and after is certainly what I do. I will get somebody to do something, I'll do the test, and then I'll retest to see if it's better, worse, or the same. If we find that the pain is all on the left, or let's just say the dysfunction, the limitations on the left, and you try the left eye and it doesn't work, and you try the right and it works, then of course you do that. You're never going to get things right all the time straight away. You need to try an exercise, you might need to try then another one. But as the key thing that I've learned is to have multiple tools in your toolbox for one problem.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow.
Hello, NeuFit Nation. Welcome back to the Undercurrent podcast. And it's happening again. NeuFit Nation is expanding into other nations or other countries of the world. We have Harry Worrow joining us today from the UK. He's up in North Yorkshire, which, as I've learned, is up near Scotland, learning my UK geography. And Harry has a really cool business called Tagfit, T-A-G, Tagfit UK. And I've known him for a while. We were chatting on social media. He's got some great educational content, and he ended up acquiring the Newbie through our UK partners, distributors there, and has been using it for several months. And I thought it would be, really excellent really great to have him on here to share both his perspective on his work that he was already doing before adding the Newbie, and then how he has thought about implementing the Newbie and how it's impacted his practice. So as he'll tell you, his background is more in personal training with a very strong emphasis in biomechanics. And so he does a lot of what we would call here in the US, a lot of neuroactivity based training, longer term rehabilitative work with individuals who have neurodegenerative conditions or neurological injuries, traumatic injuries, things like that. And then also works with general population and some with athletes even. So he's got a wide range here. And I think it's going to be very instructive to learn from Harry. So Harry, thanks for joining us.
Hello, thank you, Garrett. Thanks for having me on. It's definitely an honor. I appreciate your time. I think you've introduced me perfectly there.
Well, good. Now, in terms of introduction, before we dive into some of the nuts and bolts of your day-to-day work, can you just further the introduction, help people get to know you a little more by telling us your origin story and how you came to start this business and got into the work that you're doing now?
Yeah, for sure. I knew what I wanted to do as soon as I came out of college. I have a massive upbringing in rugby. So once I went through kind of like the rugby ranks and I was getting into my early 20s, I was getting more and more interested in the fitness side of things and how to perform and how to do certain things and become the best. And I then went through CrossFit and went into competing in CrossFit at a really elite level. I was training twice a day. And that was kind of almost more of an in-depth way of how I can get myself from doing being okay at some gymnastic movements to actually being kind of competent in them, and did a lot of training and traveling around and competing. And then I got to kind of a bit of a stopping point where I thought, oh, this is quite hard on my body, and I'm finding coaching way more rewarding, and I knew that there was lots of people to help. So I've always coached in between competing, and it was more kind of just general. I want to be strong, I want to be fit, I want to a point, aesthetics as well also come in there. But then there was more and more people that were coming to me saying, oh, I've got this niggle, I've got this ache and pain that's stopping me from doing certain things. What can we do about it? Can we still train? I was like, yeah, let's do some drills. And back then my probably expertise was definitely not as strong as it is now, but it was helping people, and they were saying, you're really good at making me feel in less pain and helping them. So I thought, okay, I think there's definitely something here. So I decided to do my degree in sports science and then take myself into being a biomechanics specialist. And then I set up Tagfit. I thought I'm just going to go for it. I was working in plenty of other gyms, and then I thought, you know what, I'm gonna build Tagfit, and I'm going to be completely self-employed. And people then just started coming to me, and that's how kind of Tagfit originated. A COVID-19, dread to say it now, the word, but it definitely brought out Tagfit. It was kind of like that stopping point of that reflection of going, I think I can do this by myself. And it was a big, scary leap to go from being kind of secure in a gym and getting paid to, yeah, I think I've got enough in my wheelhouse to actually build a coaching business. And and that's how Tagfit was brought about.
That's awesome. And can you give us a sense of the the business model, the style of how you do things, the breadth of people that you're working with? So how who are your Tagfit customers, generally speaking, and what are the types of services that you offer in terms of like group fitness classes, one-on-one? Just give us a sense of what it looks like day to day.
Yeah, sure. So my general customer has certainly changed from say 3 years ago when Tagfit was officially come out. It was, as I say, more gen pop with just general fitness and strength goals. It's now more and more gone into people that have chronic pain. MSK, musculoskeletal, hip pain, knee pain, neck pain, and from of course recent days now from investing in the Newbie device, there's so much more interest with people that have a neurodegenerative condition such as multiple sclerosis, FND, Alzheimer's, Parkinson's, ALS. So it's really opened up the doors to that kind of neurological side of things. And there's a bit of both really. It's about 50% kind of MSK problems, typically lower back and hips, and now of course the MS program that I offer people. So in terms of my business model, that has also changed a lot. Touching on whether I do group classes or one-to-one, it's all one-to-one. That's my flagship program, and I'm kind of a big believer that you can't fix individual problems in a group setting. I think group exercise is fantastic for so many different reasons, but if you're looking to fix a individual problem such as somebody in pain, you have to deal with that individual and all the surroundings that are brought up about dealing with humans. It's not just the pain, it's not the problem, it's the lifestyle, it's the nutrition, it's the mindset, it's the emotional well-being. So I'm a massive believer of kind of coaching one person at a time to help them overcome it for good. Hopefully, it might take a long time. It might not. We see. So my business model is something that I've really changed. I think a lot of people listening to this that are from the UK that are maybe personal trainers, they very much work on I will just kind of book you in and I might see you once, twice, 3 times a week, maybe more, and they just kind of like pay as you go. Or sometimes they buy blocks of say 10 to 15 to 20 sessions. And I know that I've done that in the past. That is just how I think you are trained in the UK as a personal trainer. Even a physiotherapist, you just kind of see them when you see them. However, I've taken it upon myself with my business to make more of a prescription of, I think we need this because of what you've kind of mentioned and outlined in your kind of in your life, and this is how much is affecting your life. So let's go for there's a minimum commitment that I work with clients, and that's 4 months typically. Now, of course, as you know, Garrett, it's one of those things. It's for a reason. It's not just for business. It's because you want to take that person from pain, and I take these people as much as I can towards the performance side of the spectrum. And that takes time, as you know, with the brain changing and everything like that. It takes time. It takes that consistent stimuli to do something with somebody. So my business model now is set in a way that I have a monthly commitment. So I see that person for 4 months minimum. It works great for business too, but it's not solely just for business. It's to make sure that that person feels like they have a commitment from me and they've got that support for a certain period of time. And then, we can actually make a plan to go, we've got 4 months to work with here, rather than, I don't know if I'm just going to see you for a one-off session or for, however many. So it works great in that respect. And every single client that I've worked with actually likes it because they have their set time, they have their set day, they come to see me, and they know that they've got that accountability side of things. And amongst other things that I offer, not just the one-to-one sessions, is they have lots of resources and tools to communicate with me on a weekly basis. They have the Tagfit app, which is exclusive to clients only. So they have their remote programs through there. They have some nutritional guidance. They have daily check-ins. Are they stepping enough? Are they drinking enough? And they've got these awesome little kind of gadgets that they can use per day. So I've made it more of an experience to come and work with me, rather than just, I'm just going to go see this guy, see if he can help me for a one session. So hopefully that clarifies a little bit, Garrett, on how I work with people.
Yeah, I love that. And I say that for several reasons. One is the more holistic lens through which you're looking at people. You're looking at one, understanding and communicating effectively up front, managing expectations that it's going to take time, and understanding that it's going to take more than just what they do with you, 2 or 3 hours a week, right? There's another 160, 170 something hours in the week that influence their overall result. And so to have the app and the touch points and the daily check-in and be focused on nutrition and checking in on all of these other influences that have a profound effect on the overall outcome, I think is great. And I like that notion of, if for everyone of us listening to you speak, if we're in a position, if we're desperate to get people in the door, that's one thing. But if we're in a position where we have some ability to select who we want to work with, I think selecting the people who are going to commit to working with us for that minimum of 4 months, as you said, is a good idea, because we want to work with people who are there, excuse me, not just to, go through the motion and check a box, but they're there because they want to do something. They're committed to the process, and they're demonstrating that commitment by signing up for the program. So it's a nice filter to make sure you're working with the type of people that, probably energize you, Harry, and probably would energize all of us to work with on a day-to-day basis. So I like a lot of what you've done there, and it's great.
Thank you very much. Yeah, it's tough sometimes, because I think a lot of people here have expectations of, this is how I've worked with somebody else, and it's different, and sometimes it's maybe a little bit challenging to make kind of clients understand that this is why, from a physiological kind of point of view, is, it takes time, and again, it's not just getting somebody from kind of pain and it's okay to manage. It might come back. It's like, let's just go to the other end of the spectrum if possible. And a lot of clients don't just do the 4 months. They stay on with me for years, because they just love the continuation of progress and the variety of sessions. And what we do within those sessions always changes after a certain period of time of kind of overload and adaptation. And right, that kind of looks pretty comfortable now. How else can we challenge the body? So in that respect, it's a great business model. So it works really well for business, and of course that helps lots of other trainers. Then, as I mentioned before we started talking, is just how you can then plan, because with businesses, typically in the fitness industry, it's very competitive. It's tough. There's lots of people out there, and you kind of want to be different. And for me, I think the only way to be really different is to show the results that you've got with genuine people, real people, and the reviews, and then how people speak of you, that reputation, that all stems from having something foundationally there to work with. So that 4-month period is going to allow somebody to have a really authentic view of your business, because you've taken them from here to here, and then they speak highly of you, and then they recommend you. And of course, it just works hand in hand with with business for the long term. We all want to be doing what we love for as long as possible. And I know that I would work 24 hours a day if I could. I love helping people, as long as there's a few coffees in there.
Yeah, that's awesome. And for people listening to this who might be thinking, hey, I really like this framework that Harry's using. I would like to do a version of this. I'm also curious, how do you do an app? I mean, are you a software programmer, or is this something you're able to white label or do vibe coding, or to the degree that you're comfortable sharing? How do you set that up? Because that is a cool part of the program, to be able to stay in touch. And I think there's people listening to this that own their own practices or work with people like you do, could benefit from doing a version of something like that too.
Yeah, the app is hard work. I won't beat around the bush there. It's very challenging to get something like that set up, but with the right types of people. And yeah, you have to kind of get out there and find these types of people to help you. And you want it a certain way. It's really challenging. It wasn't overnight at all, but once it has been made, it's the best thing, because of course then people can just reach into their pocket and have the exercises there. I do a lot of videoing outside of client sessions of certain exercises that will help that person, that they can then pull that up and have that exercise there, which sometimes has been needed if some people just are on holidays and they're like, my back feels a bit crap after being on a flight for 12 hours or whatever it may be, and then they can just get there to their resort or whatever and pull up the phone, so and they can do the exercises. So it's certainly hard work, but again, it's that customer experience of not just seeing me. It's you've got lots of kind of tools when you do become a customer of Tagfit and Harry.
That's awesome. So we've got a good sense of who you are and how you got into this work, got a good sense of what the business looks like. And I would like to transition next into the real nuts and bolts, or the brass tacks of what you're doing day to day. And when we first interacted, many months ago on social media, what caught my eye about you was some of the descriptions of the biomechanic perspective that you're taking on corrective exercises, the specificity and the precision. And I know that starts with your assessment, because you're working on these certain things, rotation in a certain joint or movement patterning in a certain area. You're working on those things because you've picked up something in the assessment. So let's go in order here and start with assessment. Can you talk to us, please, about your process for assessment generally, and then you can go specifically into what you might do for more gen pop or more of these neurodegenerative patients that you might be working with, to the degree that you need to. But I think a lot of it, there's overlap, and you can start generally. So let's have you talk about that, please. I think there's a lot of gold in here.
Okay. I shall do my best. So when I see or start the kind of journey with any client, for me it's starting with the person. So I'm dealing with a person who have many things going on in their life. Of course they've come to me for one reason, but realistically I need to learn about that person. I want to know a bit about them. I want to know what kind of fires them up, what they enjoy. Do they have a family? Because that's all part of starting with that person. You need to know who they are, and I think that's a really important part that maybe other practitioners can start using is getting to know the person, because that can open up a lot of information and details about why they could be in this problem right now with a certain issue that they have, physical, mental, whatever. But the assessment process after that is having just a look about how they are statically standing. So of course we are mammals that stand on 2 feet. So I just want to see somebody stand up, relaxed, and I want to see how they are winning or losing against gravity. So I'm checking from the front, the side, the back. Typically with their shoes off, I like to see people's feet because that is their foundation, and I want to see where they are placing more of that load. And then work the way up really. So what's going on in their joints? What's their alignment like? Is there any shifting? Is there any kind of falling forwards? That can then stem from their pelvis. It can stem from their rib cage. I'm taking a look how they breathe. What kind of head postures do they have? Is their heart rate? Is their kind of breathing shallow? Is it deep? What happens when they breathe? So that's the first kind of part, is just having someone stand and just seeing how they are standing, because once they move, that position can almost exaggerate. So let's just say somebody has a lateral hip shift to the left, and then they start walking, which is typically the next thing I ask them to do, is what happens then? Does that lateral hip shift exaggerate? Does it get worse? Do we see that the shoulder drops massively to that left side, which then could kind of tell me a little bit more about their kind of compressed rib cage? Is it more kind of asymmetrical? Is it kind of more intense on one side? So then I look at their gait, and I'm looking at about how they're walking up and down. What are they doing with their arms? What are they doing with their feet? What's happening at their knees? What movement patterns are being lost, such as in the joint? So what's the joint doing? What is it not doing? And then after they're walking, I will get them to do a few more dynamic tests. So typically we look at a squat. A squat is a great way to just look at their pelvis. If their pelvis in any way has a dysfunction or a limitation within the joint socket or the hip socket, then it most likely is going to come out in what their knees do to compensate, and their feet. And that kind of gives me a good idea of then what they can and can't do. It also shows a little bit about how they compensate. So do they massively hinge to try to get deeper because they lack internal rotation at the hip? So there's a few things there that I will look at, and then I'll look at some other areas such as forward folding. Forward folding is great. Of course, it's looking at how well somebody can flex forward. So what does their posterior chain do or not do? Can it turn off? Can it relax? Can they round their back? I think a lot of people might think that's a bit dangerous to do that. But actually it's totally okay as long as the client is happy to do so. Are they able to round their spine? Our spine should be pliable, so can they do that? We build into a few other things. So we look at some standing rotation to see if there is an asymmetrical angle. Can they go more right than left? And then I'm starting to build a picture a bit about this person and connect that to their problem. Let's just say it's lower back, for instance. We then go into some passive table tests. Typically, I call this a spectrum of patterns. So we're checking from the head, so cervical rotation. We're coming down into the shoulders. We're looking at adduction. We're looking at internal, external rotation. The shoulders can sometimes also reflect what the rib cage is in. Is it a healthy state? Is it decompressed? Is it expanded? Because the scapulars need to move freely over the back of the rib cage, and if they can't, then sometimes you can see that in internal, external rotation. We then go into the trunk and just have a little look at some kind of like knees going side to side. That checks adduction, abduction of the hips. And then we're just coming down into like hip internal rotation, external rotation. And then sometimes just getting the client to go face down and just seeing what the feet do when they're just kind of unloaded. So that is pretty much the assessment side of things. There is now some more neuro side of things that I am quickly learning and implementing, because I know now, especially working with more kind of neurodegenerative conditions, is what side they're most happy using, or what side of their brain are they most using. Because we know if somebody is, let's just say, with multiple sclerosis and they have a weakness on their left side, typically I've seen from over the last few months is that somebody's going to be, let's just say, happier to turn to the other side. So if I ask somebody to turn their head left compared to the right, typically I've seen that somebody doesn't really want to turn their head left, or they can't go as far, or they can't move their eyes as far to the left with their head being nice and still. And that can really then, relate into their auditory, so their hearing. I've also seen if somebody's got a kind of a weaker side on their left in terms of their eyesight or turning their head left, there's also sometimes a correlation between their hearing on the left, which is really interesting to then note that that could be also something that you can get a lot of benefit from, is just, that vestibular system, Garrett, which I know you know about and you've taught me a lot about, is if somebody is finding it hard to move left, it might not just be pure muscle strength. We know that it's that neural side of things, it's that left side of the brain, that cortex, that is then sending those signals down into that side. So I put a lot of that now into my assessment side of things to gather more information, particularly with people with neuro conditions.
That's beautifully said, and I respect and appreciate how thorough you do your assessment and how thoroughly and clearly you described it. And
thank you.
I want to, of course, we're going to transition in a little bit. Foreshadowing, we'll transition into the various corrective strategies that you use when you identify issues throughout this assessment process. I want to talk a little more first about the asymmetries that you find and some of the visual, vestibular, things like that. So if someone, as you said, is more, I guess what we would describe as a limp, or, they're sort of favoring more one side of the body, that, as you said, Harry, could be muscular, but oftentimes there's higher order issues, there's something, visual, vestibular, etc. And so one thing that I have heard a lot, and sort of one of the principles that I keep in my mind, or frameworks I keep in my mind, is that when you find issues in the visual vestibular system or neurological tests, it often is the case that the test becomes the treatment, where if looking to one side is creates a perception of threat within the nervous system and shuts down movement, you actually want to essentially do a form of exposure therapy and look to that side. And so when you find, starting at the last part of what you said, what you talked about most recently in terms of the visual and vestibular, then how do you address those? Because that's a really kind of unique and interesting thing. Is it more you do those things that you found, or you incorporate them into others? Can you just talk to us about how you kind of approach those issues that show up in that portion of the assessment?
Yeah. So like you said, the test almost becomes the drill, the treatment to regularly do. Because one thing is you can move your eyes seated. You don't have to put that person into a position of, being unsafe or making them feel unsafe. We want to make, them feel safe first, and then move the eyes in a certain way. And I know lately I've been using the Newbie in addition to this, is getting somebody to use just one side. So if, say, for instance, I have a client who has a weakness down their left side, I want to start stimulating more of the left eye. Sometimes the ears too, but mainly, let's just stay on the eyes. And I'm just using a pair of glasses that have some, it's a very high end bit of kit, but it's not really. It's just some 3D glasses with some tape over one eye. And I'm blocking out that input from the right eye, because I just want them to take a look at what I'm getting them to look at on, maybe it's in the room, maybe it's on the laptop with a bit of a brain game. They are very, very interesting to use, but also effective at just getting somebody to really focus on something moving in front of them, which then of course relates to when they do stand up eventually and start asking themselves to walk, is do they feel safe in their mind before taking that kind of initial, right, I want to move? Because as you know, Garrett, it's about that kind of whole, I see what I see in front of me, am I safe to go? Am I happy with my surroundings? So by just doing lots on the eyes and the vestibular system, we can automatically improve somebody's standing ability and them feeling more balanced. Or maybe they are happier now to shift a little bit more to the left, which takes all of that weight off their right side, which then of course changes their whole posture and their mechanics, which, lots of people might say, just try to just strengthen this left side, just constantly try to, strengthen the left side, but it doesn't always work. Sometimes it does, but most of the time you can just have a smarter way of doing things, and it's a lot faster because you're dealing with the brain. So yeah, I use a lot of kind of seated drills to begin with. It might be some kind of fancy YouTube. It's not fancy at all, but it's a cool little game on YouTube, and I'm just getting their eyes to move in lots of series of patterns. Maybe it's an attention game where they've got to just look at a dot, and there could be all sorts of things going behind that dot, and I'm asking them to keep their attention for a period of time. Or maybe I'm just trying to ask them to look at my pen in front of them and follow it, but they only use one eye. And there's also lots of other kind of drills and techniques I use, but that is for me very valuable, especially with conditions, because you can start there, and if you see that helps them kind of then do another drill that's maybe more physically based, or you're asking them to put more kind of muscular output into it, that you can actually see results there. So I know for sure when I am tailoring and designing sessions before I see a client, I'm kind of doing some kind of priming up. So I want to get that person in and feel comfortable. Maybe it's slowing their heart rate down. Maybe it's a foot bath, which I know we'll come on to, and doing some vestibular drills. So automatically they feel kind of more ready. It's almost just putting that on switch on in their brain, so they're ready for some physical activity. No different to an athlete maybe doing their drills. Maybe they've got music in their ear, which kind of helps them become more motivated, and then they start their routine. Whether it's juggling, whether it's passing a ball, whether it's golf, who knows? So that's how I come at things, and I know for sure, Garrett, I know you like to train people like athletes, and I am totally on your side there. I absolutely think that it doesn't matter what level you are at or what problem you have, you can always train like an athlete. And that's not because we want you to be an athlete, that's just because all humans should be athletic and do certain cognitive kind of things, tasks, whilst being able to have a certain output physically. And I think that's really important for kind of any coach maybe to listen to, especially if you're working more in the neurology side of things, is kind of giving variety in your sessions and not just focusing on strength, not just focusing on mobility or stretching, is have a nice, complete, comprehensive session where they're getting to do lots of things mentally, but also physically. And I think that will fasten the results and also give more client satisfaction in terms of, that was a really fun session. So then there's more buy-in. I can't wait for the next one. And then of course you can easily give these drills at home because they're not too technical to do or putting somebody in a position of unsafety. So I'm certainly loving to use more neurology exercises in my sessions.
Thank you so much for listening to the Undercurrent podcast. If you're interested in learning more about how NeuFit and the Newbie can impact your life, please visit our website at www.new.fit, that's neu.fit, so you can learn more about how it might integrate into your professional practice, how you can use it as a patient, and you can also connect with our team there.
That description there in the last 4 to 5 minutes was pure gold. I knew we were going to mine some gold there. That was really good. So
lived up to expectations. I'm glad.
A couple things that I want to comment on. What you're describing is functional neurology, and functional neurology is something that some people listening to this, may have heard about and be comfortable with. Some may have heard about it and be intimidated by, because there's so much functional neuroanatomy and knowledge of tracts in the spinal cord and so many different functional brain areas and all this. Mm-hmm. And at the foundation, it's about what you just described, Harry, in the example of, covering someone's right eye, for example. You could use the glasses you described, you could use an eye patch, but mm-hmm. getting more input into the left eye, that's going to be getting more right cortical activity. And mm-hmm. functional neurology is essentially strategically and as precisely as one can up or down regulating certain parts of the brain and nervous system. And, there, of course, it's upregulating activity in right cortex. You could also downregulate activity in one or the other side of the cortex or cerebellum
Yep.
or different areas.
Yep.
And you mentioned another thing about, some people would only want to work on one side compared to the other. And there's interesting situations just, in terms of adding a little bit into the mix here for everyone's consideration. There's cases where people have pain, that seems to be all on one side of the body. It's like, oh, my, left hip, left side of the lower back, left knee, and left ankle all hurt. It's like, they're all on the left side. And so when something like that happens, in just going one layer deeper into this field of functional neurology, when something like that happens, that can be a little bit of a trigger to think, perhaps that's a left-sided ipsilateral, same side, left-sided PMRF issue.
Mm-hmm.
And so those are cases where P for pons medulla reticular formation, pontomedullary reticular formation. Areas in the lower brainstem area that have a lot of control of flexor tone, extensor tone, pain inhibition, etc. And so that there can be an example there where someone might have all these areas of pain on the left side, and most practitioners are going to think to work on the left side, but that ends up going to the right side of the brain, which triggers down ipsilaterally to increase activity in the right side PMRF, and it actually exacerbates, it makes worse the asymmetry and the imbalance neurologically. And so in some of those cases, you actually would want to go work the right side so you get more left cortical activity, which goes down ipsilaterally to left PMRF, right? So there can be examples like that where you get into this, when you think neurologically, you get into the situation where it actually leads you to do something different than than one might typically do under a more traditional paradigm. So I just share that as an example, since you brought up the value in working one side over the other.
Definitely. I think it's important to note as well that you have the science of opposite side of the brain sending the signals, but as you said, you've got the PMRF that sends it down the same side. So I think it's important, just if somebody is coming into you, is try both and see what the results are. Is it okay, vestibular system on the left, and then kind of do it before and after is certainly what I do. I will get somebody to do something, I'll do the test, and then I'll retest to see if it's better, worse, or the same. And if we find that the pain is all on the left, or let's just say the dysfunction, the limitations on the left, and you try the left eye and it doesn't work, and you try the right and it works, then of course you do that. I guess it's very independent as well on the individual and what's going on. So I guess it's more about it's a testing. You're never going to get things right all the time straight away. You need to try an exercise. You might need to try then another one. But as the key thing that I've learned is to have multiple tools in your toolbox for one problem, because somebody with an anterior pelvic tilt that's causing back pain, you can give them the same exercises and one will work and one won't. So how do you solve that? And that's something that I pride myself on, is having certain drills and certain exercises that will achieve the same thing, but 10 different ways. And I think the more you have approach like that, the different you become, of course, the more results you can give. And of course, then people are going to acknowledge that. And hopefully you get your penance, and people then will come to you and want to use you because of that. So yeah, that's definitely something I love to keep learning.
And one of the other concepts that you just mentioned there is what I think of as another fundamental part of functional neurology, and that is that everything that we're doing is essentially detective work. We're providing an input into the nervous system, ideally with some sort of narrative in mind or idea of what we're trying to up or down regulate. And it's really an experimental detective work. We're creating this input, providing this input, and then seeing how they respond and seeing if we got the output that we're looking for or not. If we do, continue. If not, try something else. And it's I heard a great saying from one of my teachers along the way that was, you don't have to be perfect. You just have to be persistent. So you don't, as you said, Harry, you're not going to get it right the first time, every time. But the point is that it's our job to know what areas are relevant, what we're trying to affect, and then what inputs we can use. And then we can try option A. If that doesn't work, we try option B. If that doesn't work, we try option C. But the way you describe
Yeah.
that is very congruent with, one of those fundamental pieces or tenets of functional neurology there. So I really like the way you said that too.
You got it, man.
So you've already gotten into it a little bit. We went through the assessment. Now I would like to talk about what you perceive to be your most influential, most effective, powerful corrective strategies. So we've already kind of talked about some of that here in this part about functional neurology and visual and vestibular. But can you tell us more about once you've done the assessment and identify the issue with the person you're working with? Can you talk to us more about your strategies and progressions and some of the most powerful interventions that you're doing?
Yeah, sure. So let's just say we take an individual with a lateral hip shift. So I find that if somebody has a lateral hip shift to one side, that typically I see that the same side shoulder has dropped. And it's quite a common thing to see on level shoulders, and it might not seem such an issue to begin with, but when you start asking that person to move and they then become restricted, not just in, say, their hip on the left side, they're also restricted in their left shoulder, and straight away, boom, you've got some information there to say, well, we need to shift them right. So how do we do that? And there's multiple ways that we can do that. And typically to remember is what exercises are you giving that person that is going to solve their problem right now, and they're able to access that movement, because the last thing you want to do is give somebody in pain a movement that makes the pain worse, or they feel like that whole guard has gone up and they're like, I don't want to do this, because you're not going to get them to relax. And as we know, the central nervous system needs to feel relaxed to become receptive and acceptive of doing something. And if it's always uptight, then it's not going to change. So I do a lot of exercises initially that are on the floor, if somebody can kind of access that. If not, we just use a table. And if I see a lateral hip shift to the left side, then you're going to be more heavy on the outer side of your left foot. So it's going to be more supinated. You might find that even when I look at somebody, that the inner side of their foot has come up. So does that correlate to then walking? Can they pronate their foot fully? Can they extend properly on that left hip? Sometimes no. So we need to find a strategy on how we can move their hips to the right. And most of the time, I want to open up their left side of their rib cage. And that all comes down to airways. And airways are the first part of moving. So without even having to think about moving or strengthening anything, it's about their diaphragm. So typically, if somebody has got a lateral hip shift and they've got the left shoulder that's also dropped, that left side is compressed. So they're not going to be able to inflate that left side. So how can we do that? So what I typically do is get them to lay on their left side. Whether that's enough, that might be, we build the layers, is we get them to go into like a 90-90 position. So they're on their floor, they've got their pillow underneath their neck, you need that neck to relax, and make sure that cervical spine is in line with their thoracic. I like to have their feet on the wall, because I like to have a sense of grounding, because if the feet are not involved, then it makes no real kind of transfer to standing up. So I get them in 90-90, their knees are bent at 90, so are their hips. Their spine is tall but relaxed, and I'm just asking them to breathe correctly. And I want them to breathe in a way that their neck doesn't turn on. They can get a nice inhalation and fill up their rib cage. And because the floor is on their left side, the air is going to slightly more bias that left side. And that's just working with physics. Sometimes if they can't feel that, then what I do is get an ab mat, which is typically using like functional fitness, like CrossFit. They do the butterfly sit-ups. You put that underneath their side, just on top of their hip, and it goes just kind of like underneath their armpit. And that little oval shape allows that compression to come in to their left side. And then they'll find that they can feel that left side inflate more. And if you do that again and again and again, and you get them to standing, 100%, I would say 100% in all my cases that I've worked with anyway, is that they are less hip shifted to the left and their shoulder has leveled off with their right. If it's not 100%, it's going to be better. Then you can look at it as a standpoint of how can we retrain the muscles now to pull pull to the right. So you want to be looking at the rib cage again, and I look at the transverse abdominis, I look at the obliques, I look at the lats, and I'm looking now then to put somebody in a side lying position but on their right side, and I want them now to start engaging that right side. So think of it as a bit of a side plank, but with their knees bent at around 45 to say 60 degrees. And I'm asking them to stack their pelvis underneath their rib cage. So I call that neutral, or the stacking. So their pelvis is neutral. There's no anterior tilt. There's no posterior tilt. It's just neutral. Their pelvis is not flared. It's neutral again. And then I'm asking them to laterally flex to the right. So then what that happens is their obliques on the right side engage, so does their lat, so does their deepest part of their right hand side. And then we're asking them to inhale again and exhale as a sigh. So I like to say, fog up a mirror. And that deep exhale is coming from their deepest part of their diaphragm. And what that's doing is engaging muscles without even having to put any real kind of muscular output out. So by doing those two exercises, you've straight away caused that person to, from shift left to able to shift right without kind of just asking them to fall over to the right or, shift their hips to the right, which is not, it's not genuine. It's not going to stick. We need to make sure that the muscles are pulling on the bones and the joints to hold that new position. And that could be the start. And then once you've done that, you would then just level it up. So eventually, of course, you want to get everybody doing everything on their feet, right? Because that's how we move. And to be able to load, push ourselves forward, to run, to side shift, we need to always do on our feet. So that would be the end goal, is to do something on our feet. Hopefully that kind of makes a bit of a clear description of how I would simply solve a lateral hip shift. Now, of course, one session isn't enough. You need to tell the brain, you need to tell the body every single day to do that, because we know, Garrett, if the body isn't finding something important, it won't change. So we want to do it regularly, and that's just giving that software, that brain, information to do something so it changes. So I know I pinched that from you, Garrett. So you taught me that one for sure. So that's just one way I would help somebody correct a lateral hip shift. There's so many other things that I see on a day-to-day basis. Typically, people with low back pain. It's one of the highest forms of pain in the UK is lower back pain, and most of the time it's because somebody has an anterior pelvic tilt and they're just constantly extended. And an anterior pelvic tilt is not a bad thing, and I want to make that clear, because a lot of people think an anterior pelvic tilt is fine. But yeah, it is, because that's how, if we want to propel ourselves forward, if we want to run, we have to be anteriorly pelvic tilted, because that's going to allow us to internally rotate the hips and propel ourselves forward. But the problem lies is when we can't get out of it. So when somebody is anteriorly tilted and you ask them, can you pull out of that, and they can't, well, your lower back muscles are just always on, and we need to tell them how can we chill those out. And when anterior pelvic tilt happens, what it does, guys, is it actually it compresses your lumbar spine. So your discs become like a slinky; they become squished. And by always then doing movement in anterior pelvic tilt, so let's just say bending forward and picking up something, is you're asking that pelvis to roll forward when it's already rolled forward. So what happens is your hamstrings go, whoa, I can no longer lengthen. And then typically people think, I've got really tight hamstrings. Let's stretch those, because that's going to help my lower back. But it's not the root problem. The root problem lies in actually getting your pelvis out of anterior tilt and feeling that, and letting the back muscles and everything like the spine, the lumbar spine, decompress. And I do that in a number of ways. Typically, again, laying on the floor with the feet up the wall. And we're looking to get pronation at the foot. Typically, you're finding the forefoot, the first metatarsal head, which is essentially your big toe joint and the inner side of your heel. Then I ask somebody to pull their heels gently down so they can feel their hamstrings, which allows them to leverage their pelvis back into posterior tilt, which is then neutral. And then all of a sudden, they've got this decompressed state. So now I ask them to do one more thing, and we build the layers, and I ask them to correctly breathe. So now they're filling up their rib cage posteriorly and laterally, and they feel really chilled out to do it because they feel safe. It's a nice position. So, and after say 3 sets of 5 breaths breathing correctly, people are coming up and they are amazed about how their coccyx feels, how their sacrum feels, their SI joint, their lower back, of course. They feel taller, they feel more relaxed, and that's awesome because that's what we can change biomechanically. And of course, then the interventions then come on then by using the Newbie as well, and how we can implement that with these exercises to get more from them. So yeah, hopefully that makes sense, guys.
Yeah, and I want to hear more about how you're using the Newbie. There's a few things that you said there that I want to comment on. One, just as a little, tangent, when you were talking about, someone with a hip shift and seeing their shoulder, it reminds me of how interesting it can be, if you're ever bored sitting at an airport or you have a flight delay or something, just watching people's gait in the airport.
Yes, I do that all the time.
That could be a fascinating. Just see what you notice.
It's a bad habit. You want to help them straight away, but they're going to think you're weird.
And then as you were speaking, there were a couple times where these just lights in my brain were going off, metaphorically, of course, but when I loved hearing you talk about the safety, the opposite, of course, being the perception of threat, and how we need to feel safe within the nervous system, and then how you talked about the framework of inputs and outputs. Like you said something to the effect of this person with a lateral hip shift, you could just have them tell them to shift to the other side, but it's not. I think you said not genuine, or maybe putting words in your mouth, but exactly what you said there, I think was great. And the idea is that if we provide the proper inputs, they're going to begin to move more efficiently in a more balanced way, in a healthier way, naturally, without having to think about it. So when they have that situation where, as you said, Harry, when they get up and they're all of a sudden the tailbone feels better, or this feels smoother, or something else feels looser, that's what we're looking for, because they're seeing the contrast of how things were when they were in that habit and how things are when they open up this new possibility. And the key is that if it's without them having to think, yes, okay, I'm going to shift over here, if it's happening more naturally, then you're tapping into the appropriate subconscious neurological reflexive mechanisms of control that if you do that frequently enough over time, again, as you said, Harry, then you're going to be able to make lasting changes there. But it tells you you're creating an influence at the levels at which we wish to create an influence. So just really wanting to emphasize what you said there. And then at the, towards the end, Harry, you talked about how you have this strategy. Actually, there's one other thing I want to touch on before we continue on. I'm going to ask you about, to tell us more about how you're implementing the Newbie and the changes you see that. I do want to talk about one other thing. You talked about noticing the hip shift, the shoulders, seeing how that might lead to, increased supination on the side of the shift, right? As that side is accepting more weight.
Mm-hmm.
And then, you worked your way up, and at one point, if we're listening to this, it's like, okay, is he going to work on the shoulder? Oh no, he's going to work on the feet. Oh, and then he goes back and works on the ribs and the breathing. So is that a general framework for you? Are you sort of, most or all the time going more central, working diaphragm, starting middle and working your way out? Or is it not quite as much of a pattern that, I'm picking up on there?
I think 100%. I'm always looking at ground up in the respect of maybe more musculoskeletal. Of course, with more neurodegenerative, I'm always, of course, looking at kind of top down and seeing what's happening that way. I'm always looking at all angles. I never have one set protocol because sometimes doesn't work with two different people with the same issue. But I certainly would look at the airways with anybody I work with. So even with people I've worked with lately with MS, they have to use the aids of crutches, and they then typically fall to one side because that's the side that they feel strongest on. So then they can swing a leg around that they can't find genuine hip flexion at yet. And that's the compensation they have. But by doing that again and again and again, it closes off one side of their rib cage. And by just kind of asking them to strengthen up the left side of their kind of body, it doesn't really work. So I'm always looking at things from a neuro point of view now, but also just mechanically, and helping that person be able to take pressure off their, say, spine or hips by different types of positions and breathing drills to begin with. A lot of shoulder issues, for instance, could maybe just be rotator cuff. But it depends on what the kind of joints are. I'm just looking at my skeleton there, sorry. And I'm just looking at how the joint is positioned. Let's just say it's the shoulder issue, and it's the rotator cuff hurts, or the pains in the anterior delt, but that might not be the source of the problem. So maybe that scapula doesn't have space to move around the rib cage. So how can we make more space? And we make more space by kind of in to out, just like a balloon. So we want to put more air in that balloon, which is our rib cage, and then all of a sudden, there's more space in between the scapula and rib cage now. So then automatically, just by breathing in a certain position, not just by sitting there, unfortunately, it could be done in a number of ways, is that scapula now has more range to move, and then that can reduce the pain. But then what it allows us to do is train that new space, which is quite a big thing. Is once you've created that space, you want to then train that new range. So let's just say we need to get more internal rotation. So let's make space first by breathing, and then let's train that new space with, of course, certain exercises and drills to improve range of motion and strength of the rotator cuff. It's hard to say that I have one set kind of protocol, but airways are so, I think, undermined from a treatment base. I think everybody should start there, and fascia. Now this is just something new I'm throwing in there, but I think a lot of people need to look at their airways first, and then how that relates to posture and movement and function, but then also the fascia, because if fascia is dehydrated, and fascia, by the way, sorry if I'm talking out of term here, fascia is that connective tissue around the muscle, predominantly made of collagen, lots of nerve endings going through it, and the lymphatic drainage system also going through it. So if we're not touching upon that, then the body's going to feel sticky, it's going to feel tight, and often people just think it's muscles, but actually the fascia is what's wrapping around that muscle, and that dictates if it lengthens or if it contracts very well. So by pushing what's between the muscle and the fascia, which is this easy water, it's negatively charged, if we can push more of that using the Newbie or using acupressure techniques, I like to use the Newbie way more now because it's just so much faster at rehydrating the fascia. Then you become this a little kind of elastic person again, and then you are going to be able to do certain corrective exercises with more ease rather than forcing it, which never feels good.
Yeah, there's a lot of great things you said there. So starting with the breath and diaphragm work is, for many people, can be the first domino. And as you said, that's not going to be, the most important thing for every single person, but it often is important. So I'm glad you emphasized that. And then I like what you said there too about fascia. So I think everyone who's still listening, starting the conversation, will know what fascia is, and will understand everything that you said there. The ones who didn't probably weeded out already, But I like what you said there, and that's a good segue into the final topic I'd like to cover with you, which is that question of how, with this paradigm, this knowledge you have, the results you're already getting, how you've worked in the Newbie. Of course, what you just said there about helping to rehydrate and optimize the health of fascia, of connective tissue, is great. I'd love to hear you talk about that. So can you tell us more about that and whatever else is top of mind in terms of ways that you have implemented the Newbie, and then your observations of how that has influenced the results that you're getting, the rate at which you're making progress, et cetera, with your own clientele.
Oh, it's been amazing. Having the Newbie now for around just over 4 to 5 months has been kind of life changing in the respect of my coaching, but also with clients and their results. So yeah, let's touch on fascia. So how I would kind of the protocol that I use is with the electric glove, and I have that electric glove on myself, and the client has an adhesive pad on a certain area. Now, that is kind of picked up on something called the mapping protocol, which is kind of finding some hotspots of some areas of sensitivity, or maybe not so, and maybe there's not so much sensation there. But that's probably something else to touch on. But and essentially, I'm using the electric glove to run over very very gently, really, somebody's say whatever body part, and that current is just kind of tingling away. It's going into their body, and it's causing that extra circulation to that body part. And just by doing that alone for minutes, if a minute can cause a massive improvement in function, in the feeling, if a kind of area is limited in terms of movement patterns, and also just the kind of nutrients that it brings to the area, whether that's around the joint or to the muscle. So I love the electric glove. I think it's awesome, not just kind of like for the mapping initially with a client, but also then touching on to getting that fascia to become more hydrated and more elastic. And then in terms of how I'm using the Newbie on a day-to-day basis, it could be for just doing movement patterns that I want to recruit more muscle fibers of that person's body, and give them that sense of, wow, this is like heavy, but there's no weightlifting, so it's just digital load. It's just a matter of let's use certain frequencies of that Newbie and allow somebody to do a bodyweight movement which they feel really kind of happy to do, and use all the techniques that I give them, and also put the Newbie on to allow for not just extra muscle recruitment, but for that brain and muscle feedback. So then that movement becomes faster restored, and they feel happy to do it again and again. Then there's also the neurological side of things, which is kind of really heavily built into my sessions, from initially looking at the foot bath or the electric sock, and getting more stimulation into the feet, where there's so many nerve endings, and of course where you need to sense the floor. And then we can look at the hand bath for some people with, especially with MS and Alzheimer's and things like that. It can really help allow them to extend their hand again and take that tension away, because an amazing thing the Newbie does is, of course, it goes into the brain. So it's going up the arm into the cervical nerves, and it's allowing that just to kind of relax, which is just incredible after a few minutes of doing it. And another way is using it to kind of almost reboot or kickstart a pathway that may be inhibited because of the condition. So I know walking in multiple sclerosis is one of the biggest limiting movements that gets lost. And if you break that pattern down, you can look at the dorsiflexion, you can then look at the hamstring curl or the knee flexion, and then you can look at the hip flexion. And if we restore those, then of course it's going to make a huge impact into somebody's walking, amongst other things, yes. But sometimes we need to, with neuro conditions, is isolate a movement. And how I then do that is using a table, and we use the Newbie to place over certain pathways. Typically, if I'm doing hip flexion, I'll place it over the femoral input from the L2 in the spine, and I'll place it over the branches of the femoral nerve in the front of the thigh. And typically, by then using certain different frequencies, we play around with it and see what's best for them, and then use that in terms of doing more hip flexion. However, I love eccentrics. So for people listening, that's the lowering phase of a movement. That's like, you've just curled your arm and then you're slowly letting it go back out to straight. That's where, as we know, the Newbie is so effective, is that eccentric phase. And then we can play around with, whether we just need 500 frequency, which I'm going in depth here now, but that's kind of like just getting things more woken up. It's lengthening in tissues, it's improving circulation. And we can then go into using resistance. So we can lower those frequencies, and now it becomes more like heavy. So it's like somebody's got a weight strapped to their leg. And that's how I am using it to build people's strength with neuro conditions. And it's just fabulous. It really, really is. The feedback from clients doing things that they wouldn't normally be able to do at all, and being able to do it again on command. And then also you've got the side of things where they're getting more endurance. So if we can get more repetition, then of course that's great for the brain to learn. So it's giving people that option to be able to improve their function with this new revolutionary tool, rather than just kind of, I just need medicine. Or of course medicine has its own right, but there's not just one strategy now. There's other options that people are able to do. So it's just been a great investment for Tagfit and myself. I use it many of times to chill out after a hard week. So the master reset, for anybody that doesn't know, Garrett would explain much better than me, but it's just a great way to activate the vagus nerve and turn you, kind of go back into more of a parasympathetic nervous system state where everything can heal and things. And sometimes it's hard for people in this modern day and age. I know, Garrett, you would agree that we're quite high stress beings, most of us, and it's quite hard to get out of that state. And that's where all sorts of terrible things happen. So it's a great way to get my clients to relax and feel at home and peace, and then they can go into their training whilst we use other kind of techniques on the Newbie.
That's great. As everyone listening to this knows, I love and am very passionate about the Newbie, and hearing you talk about it helps me feel even more enthusiastic and more committed and greater conviction and more, committed to continuing to share this work with as many people as we can, and, to refine and improve and iterate and innovate. So I really appreciate that description there. And as we wind down, Harry, I have one final question for you, and that is, if you could shout one message from a mountaintop for everyone to hear, or put one message on a billboard for everyone to see, what would your message be?
I think after you've mentioned it, Harry is golden, but that's quite obvious because I am actually quite. So, but no, I take a huge amount of pride of people that I work with. I don't rush anything. I offer lots of variety of services, from working with me, as we all know now, for a minimum of 4 months. There's also other services that I offer. I know that I've had a few interested people that want to come over and work with me for a series of day intensives, which is something I offer. So if anyone is hearing this and they're not from the UK, then you can kind of get in touch, and I can kind of let you know about all the details of the 3 to 5 day intensives for certain neuro conditions. If you are based around the UK, then you can find me at tagfit.co.uk. That's my website. Everything's Tagfit on Instagram, on LinkedIn, on Facebook. So feel free to check me out and all the cool things that clients are doing with me. And there's lots of other kind of comprehensive courses that I do. One of them being the 12-week rehab program, which is working really, really well with people that have multiple sclerosis. So that's the advertising that I'm going to do.
And for those of you listening who don't see us on camera, the gold, of course, the information value is gold. Harry also has kind of reddish, goldish hair and is wearing a brownish, goldish outfit, and the back of in front of a wall of a similar color. So there's a lot of gold theme going on here between our conversation and the visuals as well. So you can be in on the joke if you're just listening now too.
You can call me Prince Harry. It's fine.
I like that. That's good. That's good. Well, Harry, this was really, really wonderful. I appreciate you not only coming on and sharing all of your wisdom and your frameworks and your experience with NewFit Nation, and I also appreciate the work that you're doing there every day, and your open mind and bringing in the newbie to your business and your practice, and everything that you're doing there. So I really enjoy getting to follow along and see what you're doing and compare notes and collaborate here. And yeah, just thanks again for coming on the show, and thank you, dear listener, for tuning in to this episode of the Undercurrent Podcast. We'll see you next time.